call Lord Vaizey of Didcot.
My Lords, this debate is a salutary reminder of the range of neurological conditions that have been affected by the pandemic, and I speak in my capacity as the President of SUDEP Action, a local charity in my former constituency of Wantage. SUDEP stands for Sudden Death in Epilepsy, and it's astonishing perhaps to learn that 21 people a week die suddenly of epilepsy, often in the prime of their life. 50% of those deaths could be avoided with proper treatment, and in fact epilepsy is the second most frequently reported potentially treatable cause of death. The number of women who are pregnant dying of epilepsy has also doubled in the last few years. My Lord, SUDEP Action has led international research on the impact of the pandemic on epilepsy and bereaved communities throughout 2021 with the University of Oxford and Newcastle University. And these statistics will echo some of those that have already been cited for other conditions. 40% of people with epilepsy had worsening health during the first wave of the pandemic. Almost all epilepsy sufferers have reported increasing mental strain. A third have issues with accessing care. A quarter have trouble getting their medication. And 1 in 5 have not seen a health professional in a year. 2 decades ago, the government had a national audit of epilepsy death, which brought these deaths out into the shadows and put in place, but it was only recently that steps have been taken to implement some of those recommendations. But of course, as has been echoed in other speeches, the opportunity to implement those changes have been severely put back by the impact of the pandemic. It is the case that SUDEP Action has put in place a number of protocols to help people suffering with epilepsy. They work with 1,200 health professionals to ensure a checklist that people suffering from epilepsy can use to check their health, as well as an app that allows them to monitor. 4,000 patients work with an app that allows them to monitor their condition. This wonderful charity that I work with clearly would like to see, like many other charities I suspect, that when the eventual inquiry into the COVID-19 pandemic takes place, that we look at not just COVID deaths, but also the deaths of people who have suffered from other conditions whose healthcare has been impacted. But more long-term, we need to level up epilepsy services and care provision, providing access in the community to a named coordinator of care for each individual with epilepsy. Vital levelling up of tailored communications of the risk of epilepsy is also needed nationally. Just as we broadcast the risks of asthma or diabetes, these resources already exist, but they do require national rollout and implementation and support from government.